Perineal care. So perineal care prevents skin breakdown, perineal area, itching, odor, and infection. Perineal care is very important in maintaining the client comfort. More frequent care is required for clients who are incontinent or who those have a indwelling catheter. This is the equipments that I gathered to use. For the assessment, assess the client mobility and activity tolerance, and also determine where the client will be able to assess with a perineal care. And also check the positioning or activities restriction to prevent injury the patient during this procedure. And also assist for social issues that may be concerns to the patients regarding perineal care. So for this assessment, I asked my patient for some question. Mayong buntag, ma'am, may kanang na ako diri para mangutana po, ma'am, para po sa assessment sa perineal care. Kanang ma'am, kaya ba nimo ma'am na i-wash ang imong ma'am perineal area nimo ma'am, pero kung dili nimo kaya ma'am, pwede man mi mag-assist ma'am. Okay po ma'am. So next ma'am is sa culture norms po ninyo ma'am. Like po for example po ma'am kay naaman gud sa uban ma'am na dili pwede na lalaki ang magkuan sa imo do it this assessment po ma'am. Pero sa inyo ha ma'am, okay lang pa sa inyo ma'am. So wala naman problema sa culture nimo ma'am no. Okay po. Next is for the planning, assemble equipments needed, plan for any assistance necessary. So next for the implementation, introduce self and briefly to the client, identify emergency protocol, explain to the client what we're going to do, why it is necessary, and how the client can participate, and also discuss how the results will be used in planning further care and treatments. Mayong buntag ma'am, ako gali si Redsel May Tumbaga from NDDU nursing student. So for this assessment po ma'am, I ask po at your name po ma'am, age, birth of your date po. Okay po ma'am, thank you po. So ma'am, alam naman po natin 'di ba yung mga gagawin po natin like po sa clean po ng perineal area niyo po ma'am. Okay po ma'am, I want to provide you po a privacy po ma'am ha, for the listens anxiety po. So for prevent privacy to listens anxiety and gains operations for the patient. Next is wash hand and wear clean gloves to protect the nurse for contamination. Next is positions patients on hair back supine, place waterproof pad under the patient, and also place the bedpan. So ma'am, ipasupine position ta ka ma'am para mabutang nako ang atong waterproof and then the bedpan po natin ma'am ha. Then I add your black blanket po ma'am. Next is drip the client to protect privacy. For human, positions the female client in a back-lying positions with the knees flexed and spread well apart. We assume that drip the bath blanket so that one point faces of the patient's head diamond shape, and take one of the side point of the diamond and wrap it around the patient's leg and repeat on the other leg. And fold the center lower point of the diamond up to expose the patient's perineum. And for male, place the bed blanket over the client chest. Fold the bed linens down to expose only the patient groin. So for this technique, which help maintaining privacy and prevent chilling during the procedure, so I ask my patients to see her groin. So we assume that the client is a back-lying positions with a neck flex and spreads well apart. Next, dip the cotton balls with the warm salty water. For female, using a long, gently stroke. Wipe the perineum starting for the surfaces pubic and proceed to the rectal area. Also for the male, retract the foreskin if present and gently cleanse the head of the penis using a circular motion. Replace the foreskin and finish clean the shape of the penis using firm stroke and the scrotum. Handle the scrotum with care because the area is sensitive. And always remember to wipe the perineum urethra is only one stroke to avoid contaminations of infection. And both male and female cleanse the skin fold of the groins area thoroughly and pat dry. Examine the skin creases for redness to detect the prevents excoriations and folds area where moisture colorate. Next, rinse and pat dry. Prevent skin injury secondary to maceration. And drop to the trash all the linens you use. Next, turn patients to her side, separate the buttocks and wash the posterior region. Give special attentions to perineal area. And also fecal contaminations of perineum can lead the urinary tract infections and skin irritation. Ma'am, maglimpyo na ko sa imong lubot, ma'am. Mag-sideline position lang kita, ma'am. Assist kita mag-sideline position, ma'am, para sa aning assessment na limpyuhan nako ang imong lubot. So, ma'am, punasan na nako ang imong lubot, ma'am. And also, gently massage the bony prominences in odor to promote circulations and help prevent decubitus ulcer. So, ma'am, mag-massage na ko sa imong lubot. And change linen as needed includes swollen linen or linen that become damp during perineal care. For this, ensure patient safety, comfort, and privacy. Magkuha na ko sang waterproof pad ni mo, ma'am, tapos ang imong bath blanket. Next, dispose of equipments used to prevent transmitting microorganisms, and also remove gloves and wash hands due aftercare. Prevent transmissions of intentional bacteria. For evaluation, assist client response, observes for deficiencies with movements or ROM during the procedure. Note the documentations of skin include redness and other abnormalities findings. Ma'am, anong pong feeling ninyo na tapos na po natin yung procedure sa perineal care po, ma'am? Meron ka po pang mga disadvantage po during po sa ating procedure po kanina, ma'am? Okay po, ma'am. Very good naman po. Dahil okay lang po. For documentation, nursing's note perineal care was given any client's purposes to the procedure and the conditions of perineal care. Okay, ma'am, magbalik na lang ko diri sa imuha, ma'am. Unya, ma'am, if kailangan nimo, ma'am, tawaga lang ko, ma'am. Alang ko diri, ma'am, if kailangan nimo ko, ma'am. Thank you.